Hello YouTube, I'm Dr. Fox. Today, I'd like to talk about preparing for surgery. So first of all, which healthcare professionals will be involved in your operation? A team of professionals will be involved with your care before, during, and after your operation, led by the surgeon. Nurses will help throughout, assisting doctors and ensuring you are as comfortable as you can be. Anesthesiologist will be in charge of giving the anesthesia and monitoring its effects. Next, what can you do to help ensure your surgery goes well? If you smoke, stop. General anesthesia affects your lungs and smoking weakens them. If you are taking medication, check whether you should keep taking it or stop until before your operation. It is very important that your doctors knows about any medications you take, whether prescription, over-the-counter or alternative such as dietary supplements. Some doctors ask their parents to follow a special diet before the operation. For example, diabetics are often given a diet seat which will help control their glucose levels, as this may accelerate post-operation healing. Next question. What happens during the pre-surgery checkup? Most people have a pre-surgery checkup a week or two before the operation. Doctors generally carry out a physical exam and may also order a chest X-ray and electrocardiogram to test your heart function and take blood and urine samples for lab tests. Okay, next. Will you have to make any preparations before your operation? It depends on the type of operation you are having. Your doctor may ask you to use a laxative, eat less than usual, or use an enema at home. Do not drink alcohol during the 24 hours before surgery. Okay, next. What should you do before you come into hospital on the day of your operation? To prepare for your operation, do not wear any makeup and remove nail polish and acrylic nails. You also need to remove all jewelry, including piercing. If your operation requires an overnight admission, make sure you bring essential items such as a glasses case, contact lenses, or dentures. Okay, next. What happens when you arrive at the hospital on the day of your operation? First, the nurse will give you an identity bracelet with your name and date of birth and your ID numbers. Nurses and other staff will also probably ask you for a health history, including what medications you are taking and if you are allergic to any drugs, food, or latex, which is used in some surgical gloves. Next, you will be asked to put on a hospital gown and possibly a cap. In some cases, you will also be given surgical stockings, drugs, or inflatable devices for your legs to help prevent deep vein thrombosis or DVT. Then, the other lines will take you to the waiting area, where a member of the surgical team will come and get you. Before you are taken into the operating room, a member of the surgical team will confirm your name, date of birth, and operation type. Depending on what sort of operation you are having, the surgeon or another member of the team may mark the site to be operated on your body using a special pen. The anesthesiologist will explain what type of anesthesia you are going to have and how the process works. An intravenous line may be inserted into a vein in your arm or wrist if you need fluids, medication, or blood during and after the surgery. You may also be given other medications such as relaxants and antibiotics to reduce any risk of infection. Okay, next. What happens when you are taken into the operating room? In the operating room, staff will move you onto the operating table and attach several monitors to your body so your pulse, oxygen level, and blood pressure can all be monitored during the operation. Some teams carry out a final check of essential data such as name, date of birth, and type of operation, and sometimes a review of other medical records. Then, the anesthesiologist will start work. A general anesthetic goes through your IV line, and a catheter may be inserted into your bladder when you're asleep to drain urine. Okay, next. How will you feel straight after the operation is over? You will wake up in the recovery area where post-op patients are monitored. You will probably feel confused and you may feel cold. You may also have aching muscles and a sore throat, although these generally do not last long and the nurses can give you pain relief if necessary. The nurses will get you up and moving as soon as possible, even if you are still tired, as this encourages your body to start working properly again. Okay, next. What happens at my post-operation follow-up? The post-op follow-up is your opportunity to ask your surgeon questions such as whether the surgery was as successful as expected and what effect it has had on your condition. You can also ask how long it will take for you to recover and how you can expect to feel during the recovery period. Okay, next. What happens if you need to cancel your operation? If you have a cold or a cough or high temperature in the days before the operation, let your surgeon know so they can decide whether or not to go ahead. If you cannot attend, give the hospital as much notice as possible so they can offer an appointment to someone else. Staff at the hospital will book your operation in for a later date. Next, what care will you need after your operation? You need to plan your care in advance, especially if you're elderly or vulnerable, or if you are going to need particular equipment or people to help you. If you need a wheelchair, walk frame, crutches, or other support device, ask for one before you are discharged from hospital. You may also be given an appointment to see a physiotherapist if you need to carry out particular exercises, and you and sometimes your family members will be told how to care for the wound, when to take painkillers if necessary, and how to look after any equipment. Okay, next. When will you be able to go home? Every hospital has its own discharge policy and arrangements. When you're allowed to go home depends on how quickly you get better while you are in hospital and how much care you will need after you leave. Questions commonly asked by patients before they are discharged from hospital include: who can you call if you're worried once you're back home? How independent should you try to be? For example, should you go to the toilet by yourself? Is it safe to get out of bed by yourself? Is there anything you should not do? When will you be able to return to work? Will there be any pain when you get home? When will any bruising or swelling disappear? Where do you go to have stitches removed and when? Who is in charge of your care now, the hospital or your clinic? Will there be follow-up? And so on. Okay, next question. Can you drive yourself home after surgery? My answer is no. You must ask someone to give you a lift or accompany you in a taxi. Also, you should be with another adult for at least the first 24 hours after anesthetic, whether general or epidural. Last question. How can you speed up the recovery process? Remember, it is completely normal to feel very tired when you get home, especially after a general anesthetic, and you should not push yourself too much in the first few days. However, as soon as possible, be as active as you can, as this will encourage the blood to move around your body and the wounds to heal and keep your muscles strong. Keep caring for your wound as your nurse showed you in the hospital. Moving forward, remember that you will recover more quickly and be less likely to need more surgery if you live a healthy lifestyle from now on. Eat well, take regular exercise, stop smoking if you're a smoker, cut down on alcohol, and don't take illegal drugs. Okay, thank you for watching. See you soon.